Good morning, he murmured. It is early. I am delighted to be here, delighted to have been asked to give this talk, and it could have had a lot of data in it, but we have too little time. I've been told I've got precisely 20 minutes. And so if you really want a deep dive into the data behind the study I did that I'm going to allude to here, we can have a drink later this afternoon, and I can show you on the computer. But my title is, After a Half Century of Effort, Is It Time for a Reboot? Everyone knows what a reboot is, I assume. It's when your computer isn't working well, you just reboot it. You turn it off, turn it on, and miraculously it comes to life again. Perhaps that can happen to our field, but we'll see. I have no financial conflicts of interest, sadly. I've been looking for them my entire career, but every single board, and there are nearly 75 of them over the years, has been not-for-profit, and my 4 sons have been very disappointed in that effort. I am, and it is a bit of a conflict, perhaps, the co-founder and chair of the board of the National Foundation to End Child Abuse and Neglect, otherwise known as NCAN, which is a small not-for-profit organization looking for a newly minted billionaire to give it new life. This is my outline for 20 minutes. There'll be some personal history, a brief overview of the results of the study I've been doing over the last couple of years, and a suggestion as to if you agree with me that we need a reboot, one way we could do it. So I happened to be a medical student at New York University from 1963 to 1968. 63 was not a very good year. I flunked my first year of medical school, every single course. They allowed me to repeat it. And my third year, March of 1967, a pediatrician named Henry Kempe came to New York to give it grand rounds called the battered child syndrome. His talk pretty much convinced me, there were some other things as well, that I wanted to go to Denver for a residency from New York. I also did that because my wife, who I met, was a student nurse at the time in New York, was from Chicago. I was from New York, and we realized when we got married we needed 1,000 miles from either of our in-laws if our marriage was going to survive. And I hated humidity, so Denver was as far east as I looked. I got to Denver, and on December 1st, 1968, was my first night on call at Denver General Hospital, and a mother brought in a baby who was dead. She said she was at the movies with the baby, and when the lights came up, she noticed the baby wasn't breathing. To make a long story short, the baby was dead, had brain injuries, ruptured liver and spleen, and had clearly been beaten to death. Henry asked me to go back through the records of the mother and the baby and presented at a morbidity conference a week later. And I was intrigued by that history because there were at least 24 professionals who he pointed out could have prevented the death of the baby from the time the mother showed up with no prenatal care to the multiple visits where she brought the baby in and signs were missed. I was intrigued by that process and still am. I have no personal history of being abused, thanks to my parents, who were moderate to severely nurturing, and my prep school roommate, who, when I went away to school, told me, don't be in the locker room in the gym with the history teacher alone, ever. That was good advice because he was later arrested for years of sexually abusing boys at that particular school. I did realize, however, when I started working at the Kempe Center, that my grandfather, who actually my mother said was born here in Vilnius, had sexually abused two of my relatives during our early childhood, something that our family absolutely never talked about it. And my sister, who is now 76, 6 years younger than I am, and I still have conversations every year about the silence that was pervasive around that issue. I went back to Denver after 2 years in the service. I had a general pediatric practice for a while. I was nominated for a health policy fellowship. Henry Kempe sent most of his families that needed a pediatrician where abuse was happening, and in those days it was mostly physical abuse and neglect, to my practice. And it was really fun to watch children grow up. And then he had multiple heart attacks, one in 77, one in 79. And as I headed off to Washington for a health policy fellowship, he said to me, "I know you, if you don't have something different to do than rural health, you're going to get infected with Potomac fever virus and not come back to Denver. I need you to direct my center." And so on September 1st, 1981, I became an international expert in child abuse and figured I better learn something about it because people were calling from all over the world to find out what to do about this problem. With the job came the editorship of Child Abuse and Neglect, the International Journal. I was president of this organization for its meeting in Kuala Lumpur. Sometime over a drink, asked me about the international incidents that happened as we planned for that meeting. And as Abby said, was chairing abuse and neglect. I was told by colleagues in Belgium and Netherlands in 1990, when I said that our system in the US was in trouble, that their system was better. And so I decided to go on a sabbatical. They have a confidential doctor system there. You can read about it if you have. Do you remember books? But the battered child was, you don't reboot books, by the way, you read them. There's a chapter by Catherine Marneff on how that system worked. I was intrigued. I asked them if they had any data to support their statement that it was better, and their response was, data? No, we don't seem to, never have seemed to have much data in our field as to how well we were doing. So on July 2nd, I planned for a sabbatical in Europe. On July 5th, and that's another story I won't go into, I suddenly became acting dean of our entire medical school, and that turned into a 25-year hiatus from the field. I thought it'd last 3 to 5 years, but it was longer. I returned to the Kempe Center after 25 years because as I looked around, it seemed to me in 2015 that things were not so different in our country than they were in 1990. And by no stretch of anyone's imagination would that be considered progress. I need to just say this because this is what has led to my travel odyssey and travel therapy. Mary passed away a couple of years ago. She was extraordinary. When I flunked my first year of medical school, my prep school roommate who kept me away from the history teacher said, "Come teach biology at the prep school I'm teaching in." And I said, "That sounds right." And as Mary and I drove back to New York from Connecticut, she said, "Why don't you just study?" I said, "Okay." And I got through it the next time, and life went on. She did all of these things, and I'm not going to dwell on it, but if there's a magnificent YouTube presentation that when we had a celebration of her life, and if you have a spare hour, 40 minutes, you're welcome to watch watch it. So over the last 2 years, I have been on the road visiting colleagues who have worked in the abuse field for at least 20 years or more. And I've asked them the open-ended question, so what have we accomplished in our field? About 2/3 said, that's interesting, let me think. And they said, I'm not sure. Others gave me a rifle-like list of things that we have accomplished, and there are lots of things that we've accomplished. But my view is that most of that progress is in the process of how we do this work, and we have no idea about the outcomes of what we are doing and whether the children and families who are caught up in our systems are in fact any better off at the end of that process than they were, and or whether their lives are any better, because we know this problem has been around for millennia. And there are generations of my age and older, my parents and grandparents, who experienced all forms of abuse without a child protection system that they got involved with. And we really don't know whether their outcomes are better or worse than what we are doing at the moment. I've listed there some of the things that people have said. As I said, there's a longer list. We do have evidence-based programs for prevention of physical abuse and neglect. In the U.S., it's the Nurse-Family Partnership and Healthy Families America, based on home visiting, that Henry actually did an extraordinary study on back in 1970 and showed how effective it was. In the U.S., almost all research is funded by NIH. There's never been very much in this area. NIH has felt this was a social problem, not a health or mental health problem. We now know through the work of Felitti with the ACEs and Christina Bethel and others with PACEs, positive childhood experiences, that there is a great deal of impact of abuse on health and mental health, but trying to get the research we need has been an uphill climb. Meanwhile, the child welfare system in the U.S. Swings back and forth like a pendulum. After Henry's original papers, we were saving children. We wanted to get them out of the environment where they were abused. After a decade or so, it was clear that having them in foster care was not particularly helpful and may, in fact, have hurt them. And so we swung back to family preservation, and we've gone back and forth between saving the children and preserving families for approximately 50 years. Most of those changes in a community or in a state or a country happen after a child abuse fatality, where they either change the direction of the policy or they change the director of the agency, and then everything goes back to the way it's always been. And so, as I've said, we still don't know whether the children and families who we report to these systems are any better off. I'm going to go through this. It repeats it. But for the last bullet, the lack of quality and outcome data is embarrassing. Now, I need to quickly say that that was true in medicine. I never made any mistakes in the 1970s or 80s in pediatrics, not a single one. But should I have sent a child home who came back with meningitis the next day, I had a conversation with a lawyer in the hospital, and we hoped we weren't going to be sued. On the other hand, happily, and by the way, for 30 years, people had been studying the quality and outcomes of large hospital systems, Kaiser Permanente and others in the U.S., but with de-identified data and never feeding the information back to the people who were making the mistakes. In 1999, the National Academy published an article called Across the Quality Chasm. Don Berwick was a pediatrician who got us looking at quality and outcomes, and you can't be accredited as a hospital or health system in the U.S. anymore unless you have on your website the quality and outcomes of your data. So don't get your knee replaced before you know what the infection rate is by the orthopedic surgeon who replaces your knee, and it's right there for you to see. We have nothing like that in the field of abuse and neglect, and honestly, that's embarrassing. So what do we do now? Well, we can ask all these systems to go through the transformation we did in the late 1990s and suddenly get involved in quality and outcomes. I've tried that only annually with departments of social services in Denver to no avail. But on the off chance that might not happen, I think we need a reboot. So what do we mean by a reboot? When my colleague, actually former patient, Lori Poland, and I started ISPCAN back in 2017, we asked this question in the journal, the International Journal of Child Maltreatment, if we could have a do-over. We didn't want to start a foundation, and even if we could have raised a lot of money instead of using my retirement plan for it, we felt that we needed to do something different. So the question was, if we were starting over, could we construct the ideal research, training, clinical, and prevention programs to assure that all abused and neglected children and their families would get the treatment, care, and support that they needed throughout their lifespan? And what would we need to do to make sure that every child born in our area, whether it's a city, state, country, could grow up in an abuse-free environment? So how could we have a do-over? Years ago, back in the 1970s, the Robert Wood Johnson Foundation had a program called the Rural Infant Care Program. They identified places, counties, and places throughout the United States where the maternal, neonatal, and infant mortality rates were double or triple the national average or their state average. And they put out a letter. They said, we want to see letters of intent. And they invited the medical schools, there were 49 medical schools in those places around the country, to get together with the public health department and with the local community. It had to be the obstetricians, the pediatricians, neonatologists, public health, and the local community, and design a program that would bring their levels down. And they gave them $700,000, which was a lot of money back in 1979. And offered it to 44 medical schools or 49 medical schools in the United States. 29 applied, we funded 10, and 4 years later, in an evaluation that was done by the Harvard School of Public Health, 9 of the 10 that were funded had brought all of their adverse rates down to at or below the state average within 3 years. What was even more interesting was of the 19 that weren't funded, they were all but 2 of those brought their things down because they said, 700,000 is not a lot of money. Let's just do it. And they did. So that model, it seems to me, is where my search for a billionaire comes in. Instead of thinking that any government can or will assure that all of the children born in its jurisdiction can grow up in an abuse-free environment, we just need to be able to give communities the opportunities, knowing what we know now, which is a lot more than we knew 50 years ago, as to how to design an approach. It can require changing health systems, This is where a lot of the conversation around public health approaches to child prevention, child abuse come from. It will take efforts like Strong Communities for Children, which Gary Melton wrote a lot about before his untimely death a number of years ago. But it'll also require that we start paying attention to boys. Because something's going on with the 3 to 10-year-old boys in our community that no one knows about and they're not talking about and will never talk about. As I said yesterday in a session we had, the average age for disclosure of sexual abuse in women is mid-50s. The average age for men is never. With the experience so many of us have had with our prep school teachers and others, we know it exists, but we kind of need the men's movement to help us along. So we've had a number of different approaches. Civil and family court involvement was what we had in the early days. When we rediscovered sexual abuse, it was immediately a criminal offense. And we're all desperately trying to make a criminal justice system that's designed to protect criminals work for children, but it won't very easily. None of these as yet have demonstrated the kind of effectiveness that I think we need. All of them should be tested and evaluated. And as I say at the end here, and I am coming to the end, we don't want to be at the 75th anniversary of this organization and still not know if we're actually helping children and families. So I thank my research teammates at the Kempe Center. I thank everybody who filled out a questionnaire or decided to have lunch or dinner with me over the last 2 years during my travel therapy period. And I'm deeply grateful to United Airlines, who I'm approaching 4 million miles of flying with, and LOT, Polish Airways, which got me here from Chicago with no balloons and no other things getting in our way. Happy to take any comments or questions later.